क्या किया आपने? वो फिर से गया।
नहीं सर, एक बार वॉइस चेक कर लीजिए, माइक में दिक्कत हो रही है।
Gone. Gone. It's gone again. Hello everyone. Let's start the class. Good evening. Very good evening. Darshil. Yes, Darshil, first prof means it is for the first year, right? So from my side, audio video is fine. Let me know if you can also see me, hear me on the YouTube. Can we start the class? Today we are going to talk about the body water and its measurement. Yesterday the NEET PG was done and it was a bit of a difficult questions that they have given in the NEET PG. That is the usual trend that we expected. Good afternoon, Sandeep. So that whenever the exams gets postponed, it is going to be a little bit difficult, right? That is the trend throughout the last few years that we have seen. That usually occurs, but there is no need to worry, because if it is difficult for you, it is going to be difficult for many other students also, right? So the overall cut down will come down, so no need to worry. But yes, we need to prepare, especially the students who are in first year. You have to read the Genong and Guyton. At least you have to read the diagrams, you have to check out the graphs, right? Because they're asking in the depth. Even if you have gone through in your first years through all these things, it will be easier for you. Hi Vikram, hi KK, good evening, good evening. Can we start the class? Can we start the class? So let's start the class with the body water and its measurement. So 60 to 70% of your body weight is made up of the water, right? And we do have different compartments. We are going to look over there, and if you guys answered me nicely, right, if you guys replied me nicely, definitely we are going to see the shift of body water also. So let's start the class with a wonderful slide. Yes, Tanish, right? So shift 2 was difficult, but don't worry, they have the PSM people to do the stats over there, so don't worry, they are going to manage the errors that have come between two gaps. It is going to happen, right? One or the other shift will be difficult, but don't worry, they will nullify the errors. They will try to nullify the errors at least. So sometimes the smallest step in the right direction ends up being the biggest step of our life, and that's why we have started the first prof, second prof, third prof. Why? Because you can learn the concept in depth, right? So all in one question. It's okay, KK. We will try. The trying is in our hand. All right. So let's start with the total body water. Now, before starting the body water and its classification, I want you to remember one rule. What is the rule that I want you to remember is 60-40-20 rule. What is the rule? 60-40-20 rule. Now, what is the 60-40-20 rule? Understand? 60 is the body weight is going to be given, and they will ask you to calculate, especially. So remember, if they ask you to calculate the total body water when the weight is given, so please remember, out of the total body weight, the total body water is going to be 60%. The ICF, that means intracellular fluid, is going to be 40%, and ECF is going to be 20%, right? So what you guys are going to remember is the 60-40-20 rule. 60-40-20 rule. 60% is the total body water, 40% ICF, 20% is going to be the ECF, isn't it? So let's start. Good evening, Satish. So let's talk about the body weight. Let's assume that the body weight is 100%. Then the total body water, I just now told you, it is going to be 60%, especially in the males, right? So there are going to be some exceptions. So write down the exceptions. Usually I don't tell that in the class. So exceptions. What are the exceptions? First, if it is a male, I agree that in the male, I'm going to have 60% of the 60% of the body weight is going to be the total body water. But in case of females, F for females, and female contains more fat, right? Female contains more fat. So that's why what is going to happen? Hi, Maltesh. Good evening. So the body water, I told you in the first go itself that the water and the fat, they don't go hand in hand, right? So that is going to be the F for female, F for fat. I'm very happy that you got 95 out of 100. Very nice, very nice. Keep it up and keep that motivation high, right? And every other subjects also you have to rock. Okay, so female is going to be having more fat, so she's going to have less water. How much? 50 to around 55%. It is written as 50 to 55%. So if one value you have to choose, you are going to go with the 55%. So female have less water. On the other hand, if I talk about the newborn babies, they do have more water. How much more? Can you tell me how much more? It is going to be 70 to 75% of, if I have to choose, I'll go with the 75% of body weight is going to be, total body water, right? And one more thing, if the baby is prematurely born, so premature birth, so premature baby is going to be having much more water. It can go up to 90% also. Now understand, the body weight, amongst that the 90% is the water, and as soon as the baby starts having diarrhea, we are very, very worried. Why we are worried? Because please remember that the out of the body weight, total body weight, the 70 to 75% of the term baby and preterm baby is going to be up to 90% having the water in their bodies. And whenever they are going to have diarrhea, they are going to lose the water very, 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 very quickly, right? And various complications can occur. So that's why we are worried when the baby starts having diarrhea. That's the basis behind the newborn baby's diarrhea and why we are so worried. Okay, so please remember that. Now they are going to ask two more questions to you, especially in the INICET exam, and nowadays they have started the first prof also having the MCQs. So what they're going to ask is, when the ICF of the baby will be equal to ECF. So please remember, whenever the baby is of 3 to 4 months, right, after birth, so their ICF will be equal to ECF. And when the baby's composition will be equal to adult, so the baby's body water composition will be equal to adult or similar to, equal to तो नहीं लिख सकते, let's write the similar to, the composition becomes similar to adults. I'm talking about composition, not the amount. So please remember, that means ICF is going to be 60%, ICF is going to be 40%, and the ECF is going to be 20%. When this is going to occur? At around 1 year. When the infancy is completed, at the 1 year of age, the baby is going to have the body water composition which is equal to adults. So if they have given you the graph, what they can give you? They can give you like body water on the y-axis and the age on the x-axis. Let's say it is the birth occurred over here. The baby is born over here, right? Now what will happen? Please remember, as soon as I talk about the ECF is going to be much more as compared to the ICF before the baby is born. And later on it start decreasing. And if I talk about the ICF, the cells are very, very less in the fetal life, right? So what will happen? Definitely it is going to be very, very less, and later on it will start increasing. So if I ask you the question, what will be this point? This point is nothing but 3 to 4 months of age. So let's write the age in months, and whenever it will become the composition equal to the composition of adults. So that is going to be, let's write, this is the ECF. ECF is lesser and the ICF is much more, right? So this is going to be the graph. And please remember, in the fetal life, the baby is going to have lesser amount of ICF and more amount of ECF, because cells are forming and then it is going to have the water inside it later on, right? So two questions they are going to ask. Please remember that if they ask when the baby is going to have the ICF is equal to ECF, if they ask this question, your answer should be 3 to 4 months. But if they ask when the baby is going to have the similar composition as adults, right? I'm not saying amount, I'm saying just composition. That means the ICF is going to be double that of the ECF, is almost double that of the ECF. So that is going to be the 1 year of age. 1 year of age, at that point, the baby is going to have ICF is equal to ECF, right? Let's move on. So these are the exceptions. If they just ask to calculate, you will be able to calculate that, right? So let's talk about the ICF. ICF is what? Intracellular fluid. Intracellular fluid. That is going to be ICF, isn't it? ICF. And extracellular fluid, that is going to be ECF, isn't it? Now, please remember, you require more water inside the cell. Why? Because all the factory is present inside my cell. What do you mean by factory? Factory means all the mitochondria, Golgi apparatus, nucleus, ribosomes, everything, everything is present in the, what thing? It is present inside the cell. So it is like a factory of the energy production. So I require more water. How much more water? 40% of the body weight and 60% of the body weight will be present in the intra and extracellular fluid, isn't it? If I divide this extracellular fluid, of course intracellular fluid will not have any division, but if I divide the extracellular fluid, I'm going to divide that into 3 parts. What are the 3 parts? First is going to be the plasma, second is going to be the interstitial fluid, and third is going to be something known as transcellular fluid. Transcellular fluid is the fluid which is present in the cavities. Transcellular fluid, right? But please remember, it is less than 1.5% or less than 1 liter or kg, you can say. In whole total body weight, it is going to be less than 1 liter. So should I be bothering about this? No, I will not bother about this, because this is the fluid which is going to be present in the cavities, right? So whatever fluid which is going to be present in the cavities, body cavities, not the dental cavities that I'm talking about, it's the body cavity, right? So the body cavities, that means you're going to have different cavities, such as pleural cavity, pericardial cavity, right? Peritoneal cavity. So pericardial cavity, peritoneal cavity, even the CSF, which is present inside the cranial cavity, right? Then you are going to have aqueous humor. Aqueous humor, vitreous humor, what is all this? These are nothing but the fluids that are present, that are going to be present in the eye of a person, right? So aqueous humor, vitreous humor, they are present in the cavity of the eyeball, right? So all of these, even the synovial fluid, that is going to come under the transcellular fluid. But I'm not going to bother about it. Why I'm not going to bother about it? But because please remember, this is going to be very less, so let's not bother about it, right? We have different topics to bother about, right? But just remember, they have one chance that the transcellular fluid is a part of course it is going to be a part of extracellular fluid. There is no subdivision of the intracellular fluid. Okay, now amongst the plasma and the interstitial fluid, which one is having big name? It is going to be the interstitial fluid. So its contribution is also going to be larger. So please remember, the contribution of interstitial fluid. The contribution of interstitial fluid is going to be the 75% out of the ECF and 25% of ECF is going to be the plasma. almost 25%. If I take 100% as the extracellular fluid, I'm doing the color coding over here. If I'm writing in the red means that is along, I'm taking the 100% extracellular fluid, I'm taking the ECF as 100% over here, right? And if I take the body water as 100%, then definitely I have to calculate like from the 60%, I'm going to do the 3 parts of 60% and the 1 part, that means the 60% of the, it is going to be the 40 and 66, just corrected. 60% is total body water and the ICF is going to be 40%, and this is going to be 20%. This is going to be 20%, not 60%. It is going to be 20%, right? The plasma is going to be 25% and 75% is going to be out of the 20%. I'm going to have the 15% of body weight. 15% of the body weight is going to be interstitial. Only teeny tiny 5% of the body weight is going to be the plasma. Now, if I ask you the volume of blood, right? So if I ask you blood volume, it is usually 3%. Blood volume, or how you are going to calculate the total blood volume, the cell volume plus plasma, isn't it? The cell volume plus plasma. So cell volume is going to be 3%, plasma is going to be 5%. So what do you think? How much will be the blood volume? The blood volume usually is 8%. 8%. Why? Because most of the cells are going to be coming under 3% of the total body weight. All right. So please remember that. Now, how to measure them? How to measure them? So let's see what do you mean by ICF? What do you mean by ECF? Right? And then we are going to move ahead. Okay. So estimation of body fluid. If I have to measure the body water, what should I do? I cannot place the person in the sugarcane juice machine, right? Otherwise, I'll be in jail, right? So what will happen? My license will be cancelled, right? So we cannot do that. We have to measure the body water. So how can I measure? I cannot, take out the juice out of the person. So I have to find out some other method, that is nothing but the dye dilution method or indicator method. How is the dye dilution method is going to work? Tell me. What we are going to do, we are going to take a syringe. We are going to put the dye into the venous system, right? Now, what will happen if I give the IV dye? If I give the IV dye, that dye is going to distribute along the body water, right? Let's say I take a dye, right? So I'll come on to that. Suppose these are the cells and these are, let's say this is the tissue, right? And let's say this is the blood vessel and this is the interstitial in between. Of course, the blood vessel, whatever fluid I'm going to have, I'm going to call it as plasma. Inside the cell, whatever fluid I'm going to have, I'm going to call it as ICF. And outside the cell, whatever fluid I'm going to have, I'm going to call that as, if I take total, this will be ECF, isn't it? But there is some fluid which is going to be present between the plasma and ICF. This fluid will be called as interstitial fluid. I'm going to write it as IF. Interstitial fluid, that is going to be interstitial, means Stitia means tissue, right? And between the plasma, which is made up of endothelial cells, and the tissue, I'm going to have, between the tissue, I'm going to have the water interstitial fluid. Now, let's say we took the syringe, right? You took the syringe and then what you did, you have inserted a certain amount of dye. Let's say any dye for that matter, you have inserted the dye with the help of the syringe. With the help of the syringe, let's say you inserted this yellow color dye. Now, this yellow color dye was very, very, soluble throughout the lipid, and that's why it can able to cross the plasma membrane. It is able to cross the cell membrane also. Now, if it is going everywhere, this dye is going to give me total body water, isn't it? So why? Because it is going everywhere. How can I measure that dye? what I'm going to do is I'm going to allow, as soon as I put the dye into the veins, I'm going to allow some time to that dye to get distributed everywhere equally. Once everywhere it is distributed equally, what I'm going to take? I'm going to take a small sample and I'm going to see how much concentration of the dye is going to be present, right? And as soon as I got to know that this much concentration is present in whatever amount of blood I have taken out, so I'm going to take that I'm going to multiply that according to its amount that I have given. So accordingly, I'm going to get how much is the total body water, right? So what I just now said is that if I have to measure the total body water, what I need to do, I need to calculate the volume of that particular compartment. I know what is the property of the dye, right? If it is able to cross all the membranes, it is going to, go everywhere. So I'm going to use that dye for the measurement of total body water. Similarly, we are going to use the dye for the ECF. Similarly, we are going to use the dye for the plasma membrane, also plasma measurement also. So what is the formula? The first formula we read is this one, that is estimation of body fluid. So how you can remember? You can remember ABC. What is ABC? A upon B, A upon C, that is A by C, right? Remember in +1, +2, in 10th standard, in the 8th standard, we used to learn that CV, that is concentration into volume, will be equal to the amount, isn't it? We just changed the formula that we have to calculate the volume. So we have taken the concentration that side, it will be go in the denominator, right? But there is one more problem. What is one more problem? The one more problem is that my body is not that ideal situation. My body is not ideal means it is going to take up the dye. Okay, I agree, it is going to allow it to distribute, that is okay, fine, that is also fine. But it is going to metabolize some dye, or it is going to excrete some dye. If it is going to metabolize or excrete some dye, what will happen? That will not be distributed, isn't it? So I can get the false volume. So I don't want that. So what I need to do is I need to excrete that. Whatever dye was excreted, I have to subtract that dye. So write down what is A is equal to the amount of dye. Amount of dye, we of course we are going to calculate that first, and then only we are going to introduce that into the patient or the subject, right? Amount of dye. E is the dye, amount of dye that got excreted or metabolized dye. The dye which got excreted or metabolized, that is nothing but what thing? We're going to take it as E, excreted. We are not going to calculate that into the amount. Why? Because it is excreted, it is not distributed throughout the body, isn't it? And C means the concentration of the dye, right? So that will be the formula, and this method is known as dye dilution method or indicator method. This is known as dye dilution method or indicator method. And if they ask principle, on which principle this is based, so please remember the principle on which this is based is nothing but Stewart-Hamilton principle. Stewart-Hamilton principle, I'm writing it over here. The principle on which it is based is known as Stewart-Hamilton principle. Stewart-Hamilton principle is the principle on which this formula is based or the calculation is based. So we have to know that. So please remember CV is equal to amount. So when I have to calculate the volume, I'm going to do A by C, right? The ABC minus EY, because my body is going to excrete or metabolize some amount of dye. Once it is done, what I'm going to do, I'm going to calculate the concentration, use that formula, I'll get to know what is the volume. But if I have to calculate the different compartments, I have to use the dye which are going to have different properties. What I mean by that, let's see that. If I have to measure the total body water, I need a dye which can cross the plasma membrane and which can also cross the ICF, that is, which can also go in the ICF, that means which can also cross the cell membrane, isn't it? But if I need the dye which is only giving me ECF, then what can I do? I'm going to use the dye. Let's say this is the blue dye that we have used next time. It is able to cross the plasma membrane, but it will not be able to cross the cell membrane. This is its property, that it cannot cross the cell membrane. Then this blue color dye is going to give me only and only ECF volume. Why? Because it is not going into the cell. That means it will not be distributed into the cell, and that's why it will be able to give me only and only which volume? The ECF volume, right? Let's take another dye. Let's take another dye. Let's say I have taken the green dye. All right. Now this green dye was not even able to cross the plasma membrane. Then it will be only distributed into the plasma. Why? Because it is not able to cross the plasma membrane. It will not be able to go in the interstitial fluid. If it is not going into the interstitial fluid, of course, it will not be giving me that distribution, right? So it is only and only going to give me the plasma and plasma only. So plasma volume only. All right. So depending on the properties of the dye, that means whether they are able to cross the plasma membrane and the cell membrane, I'm going to have different kinds of dye that are available. Now, if I ask you that if I have to measure the ICF, tell me, yes. So tell me, if I have to measure the ICF, can I measure that with the dye dilution method, right? If you have given the dye, and measured the volume, this is known as, if you used one dye and measure the volume of that particular compartment, this will be called as direct method. But if I ask you, can I calculate the ICF directly? No, I cannot calculate ICF. Why? Because please remember, whenever I'm going to give the dye, I'm going to give that in the vein, right? And whenever I'm going to give that in the vein, it will go in the plasma, it will go into the interstitial fluid. Then you will say, ma'am, give it directly into the cell. Please remember, different types of cell will contain different types of body water, different amount of body water, right? So I have to give the dye into all the cells, different types of cells, and then calculate the concentration by taking out the volume out of them. So you have trillions and trillions of cells which are present in your body. Remember, they are not only superficial, they are present in deep inside the tissues also, like hepatocyte, the neurons, right? The splenic cells, the renal cells. You cannot do that. So what instead we are going to do? We are going to measure we are going to measure all these via indirect method. Indirect method. We are going to use the indirect method for the measurement of ICF, and similarly I require the indirect method for the IF also. Why? Because again, it's the same funda, that without going into the plasma, I cannot enter into the interstitial fluid, and different organs are going to have different amount of interstitial fluid. Okay, so I cannot generalize that also. So please remember, what do you mean by indirect method? Please remember that indirect method is going to be used for two purposes. Either I need to calculate, when I need to calculate the ICF, or when I need to calculate the IF, that is nothing but intracellular fluid. How can I calculate? Total body water minus ECF is going to give me the intracellular fluid, and when I talk about the interstitial fluid, it is going to be the ECF minus plasma. So see over here, in indirect method, I require two different dyes. So what I'm going to do, first of all, I'm going to measure the total body water. What do you mean by total body water? Total body water is nothing but the ECF plus ICF. So this is, let's say, ECF. Then you have ICF in this. When I combine these two, that will become total body water. Isn't it? So what I'm going to do, first of all, I'm going to measure the total body water, and then I'm going to subtract the ECF. I'm going to measure total body water, and then I'm going to subtract ECF. Definitely, I'm going to get the value of ICF. You're going to get the value of ICF, isn't it? Now, how to remember this? Please remember, indirect method will be measuring II. So if I have the II in the name of that particular compartment, that is intracellular fluid or interstitial fluid. So in, you can remember II, or in, you're going to use the indirect method, right? Easy to remember. Now, what are the specific dyes that I'm going to use, that I also need to require to, remember the dyes. So first of all, let's talk about the calculation part, and then we'll go towards the dyes, right? So we have to use this formula, A minus E upon C, A minus E upon C. So this is the formula. Can you solve this? Yes, I'm waiting for your answers, right? So meanwhile, I'll give you the hints, right? Let's see, will you be able to answer me or not? Okay, so 5 gram of mannitol was given, injected intravenously. So IV, how much is the amount? The amount has been given, that is nothing but 5 gram. 5 gram, right? And how much got excreted? See over here, 40% got excreted. So value of E is going to be 40% of 5 gram. How much that will be? That will become 2 gram, isn't it? So if I have to calculate A minus E, A minus E will be 5 minus 2, that will be 3 gram. 3 gram. So that is going to come in the numerator, right? But this is in the gram, and see over here the concentration that they have given of the mannitol concentration. Yes, please. You have got to the answer or not? The concentration that they have given is 30 mg%. So please remember, the gram is different and milligram is different. Whenever I need to, divide the one value with another value, I need to get them into same units, right? So over here, if I ask you, what is the concentration of the mannitol over here is 30 mg%. Now, whenever the examiner is going to write as percent means 100 ml. Percent means 100 ml, and for 100 ml you can use the deciliter word also. So either the examiner calls it as percentage, 100 ml, deciliter, one and the same thing, सब एक ही चीज है, right? So percentage बोल लो, 100 ml बोल लो, deciliter बोल लो, एक ही बात है, right? So what I'm going to do, instead of the percentage, because percentage is going to be the percentage, so I have to calculate the value. So I'm going to write it as 30 mg per 100 ml. So it is easier to get the grams into the milligram rather than doing the reverse thing and calculate the decimal points, right? So what I'm going to do, I'm going to make this 3 gram into milligram. So that will become 3000 milligram, isn't it? 1 gram is 1000 milligram. So 3 gram is going to be 3000 milligram. Now, it will be very easy. Now, can you calculate? A minus E? A minus E right now is going to be, the formula will be A minus E upon C. A minus E already we have calculated over here, and the C we already know. So A minus E is how much? A minus E is 3000 milligram, isn't it? And upon 30 milligram into 100. Why? Because 30 milligram percent means per 100 ml. So that 100 becomes numerator, right? Denominator becomes numerator. So how much it will be? First of all, see over here, mg will cancel out, right? This 0 is also going to cancel out, and it will become 100, right? So 100 into 100, that is going to be, yes, please, the value is going to be 10,000 ml. 10,000 ml, because this was the black one, is this was the ml. mg got cancel out, and the value that is going to come, that will be 10,000 ml. But the answer is in liters. So if I convert that 10,000 ml into liter, that will be 10 liters. 10 liters is going to be the answer. That's how you're going to solve the question. It took a lot of time. Why? Because I need to make you understand how I did it. But when you're going to do it on your own, it will take lesser time for sure. Right? So A minus E upon C, A minus E upon C, and nowadays they started giving you calculators also. So please remember, at least the formula is must to know. Okay, let's move on. What if the leakage of the dye occurs? Please remember, whenever the dye is going to leak out, but we don't take that into consideration. What I'm saying, that the dye got leak out, but the scientist, whomsoever was doing the calculations, he didn't notice that, right? It was the unnoticed leakage of the dye. So what will happen to the concentration? Of course, the dye got leaked out, so concentration will decrease, isn't it? So please write down what will happen to the concentration. So if the dye leaks out, the concentration will decrease. the concentration of the dye is going to decrease. Now the concentration is coming into the denominator, and what I told you, whenever anything comes into the denominator, what happens to the ratio? The ratio is going to increase, right? The ratio and the denominator is always inversely proportional to each other. So what will happen now? So remember, volume is equal to a minus E upon C. We are just changing the C. If the C is decreased, of course the volume is going to be increased. Why does that happen? If the C is decreased, of course the volume is going to increase, because they are inversely proportional to each other. They are inversely proportional to each other, and that's why what is going to happen, definitely the volume is going to increase. But is it the true increment in the volume? No, it is because the dye has leaked outside, and that's why the scientist whomsoever is calculating, he didn't notice the leakage of the dye, and that's why he is going to get the false high volume. False high value. Now they can give you another example also. They will say that the calculation, let's say the scientist was standing, or the doctor whomsoever is operating on that particular animal, or we usually do the experiments in the animal, right? We directly don't do it into the human beings. So let's say you take any animal and you wanted to introduce the dye, but the calculation, the measurement got somewhat defective, or impaired measurement is there. That means whomsoever the staff, whomsoever was giving you the injection, or who was doing the measurement, he measured it faulty. That means if the fault is there, that means if he gives you more amount of dye, what will happen? If he give more amount of dye, there is a miscalculation, right? If we give more amount of dye, what will happen to the concentration? The concentration is of the dye is going to increase, right? More dye is available, so concentration will be high also, right? So what will happen? That will enhance the concentration of the dye, right? But while calculating, we are taking lesser amount whatever we had decided that we are taking, but the staff has miscalculated that, right? So that will not come into the amount, but that is there in the concentration. So now what will happen? Tell me what will happen. If you have increased the concentration, of course the volume will decrease. Volume will decrease. Volume will decrease. Vice versa is going to occur. Why? Because the amount we are not increasing. Why? Because we didn't know, right? Let's say we are the scientist and some staff gave me the miscalculated or mismeasured dye, amount of dye, and I inserted that into the animal. Definitely I'm going to get the lesser amount, and the more and more concentration. The volume that I'm going to get is going to be the low volume, and that will be the false low, because of the miscalculation. This question has already been asked in the AIMS exam in 2019, right? So please remember, before that also they have asked many a times. So you have to remember that whenever the leakage occurs or miscalculation occurs, that means there is some error that has occurred, so that will affect the concentration directly. Okay, so that will affect the concentration, and that is ultimately going to reverse the what thing? The amount, or the reverse the volume. Okay, because they are inversely proportional to each other. Now, according to the properties of the dye, there are different dyes which are going to be present, that we should know. So see over here, the same diagram is given. We have already talked about it. Just a quick recap. So this is the total body water inside the cell. I'm going to have ICF outside it. Whatever is present, I'm going to call that as ECF. So see over here, this is the ECF which is given, and whatever is present inside the blood vessel, I'm going to call it as plasma volume. And if the water is not there between inside the plasma and not inside the cells also, I'm going to call it as interstitial fluid, because stitia means cells. It is present between the cells. I'm going to call it as interstitial fluid, isn't it? Now if I calculate the ECF as well as ICF, both are together going to form total body water. And we all know that there are two types of dye dilution method. First is the direct method, in which I'm going to give the dye to the person, right, or the animal, and I'm going to take out the small sample of the blood. I'm going to measure the concentration. I know how much is excreted. According to that, I'm going to calculate the volume according to Stewart-Hamilton principle. But if it is not possible, I'm going to do indirect method. And in the indirect method, I have to use two dyes. So please remember, indirect method via which I'm going to calculate the ICF or IF, that is intracellular fluid or interstitial fluid. Intracellular fluid is going to be the total body water minus ECF, and the ECF minus plasma is going to be the interstitial fluid, isn't it? Now let's see the dyes that are important and how we remembered that. We remembered that via II. If I write it completely, you can remember the in also intracellular fluid and interstitial fluid. Okay, so indirect method. So let's talk about the dye. So total body water, ECF and plasma. These are the three things which are going to be measured by direct method. Now, how to measure total body water? Please remember, if I ask you to give me dihydrogen oxide, will you able to give me dihydrogen oxide? Yes. Why? Because this is nothing but water, isn't it? Just the fancy name I used. Okay. So dihydrogen oxide is H2O. We are going to use the twin brothers of H2O to measure the total body water. Right? What are they? They are nothing but the D2O and T2O. D2O is also known as deuterium oxide. And T2O, that is nothing but the tritium oxide. But please remember, not only that, we do have another dye for the total body water, that is nothing but aminopyrin, which is also be called as antipyrin. Antipyrin bolo, aminopyrin bolo, baat ek hi hai. Okay, it's one and the same thing, just the another name for it. Okay, now if I have to ask you that which are the dyes which are going to be measuring the ECF, that means extracellular fluid, can you tell me the dyes? Fatafat batao, what are the dyes which are going to be measuring the ECF? That is nothing but the Simon, which is going to measure the ECF. What is Simon? How to remember the Simon? Please remember SIMAN. Now what is Simon? Simon is sucrose, inulin, mannitol, and radio-labeled sodium. Radio-labeled sodium, please remember this is tricky. N is tricky. Why? Because N is nothing but the sodium. It is the symbol for sodium, right? And this should be radio-labeled. Why? Because why I need to label it with the radioactive isotopes? Because I'm already having the sodium into my ECF, and if I give the ECF from outside, I'll not be able to know which sodium was already present in the patient's body and which one I have given to the patient, right? So it will be all jumbled up with each other. I don't want that, and that's why I have to label it. So to identify which one I have given, so that's why it should be radio labeled. I'm going to label that with the iothalamate or thiosulfate. Iothalamate or thiosulfate. So please remember, sucrose, inulin, mannitol, and sodium, that is a radio-labeled sodium iothalamate or sodium thiosulfate. If I ask you which one of these is most accurate, most accurate is going to be the polysaccharide that is present, that is nothing but inulin and inulin only. Inulin is the most accurate form of the substance which can give me the most accurate volume of ECF, right? Now coming on to the plasma, if I ask you how do you measure the plasma, yes, anybody who attended my class, you guys must be knowing that, right? Batao, plasma किससे measure करते हैं? how you are going to measure the plasma. If this question comes, what you are going to remember, you are going to remember the asthma in its name. Asthma means sky in Hindi, right? In Hindi, asthma means sky, and sky usually is blue sky, right? So blue sky. So please remember the dye that we are going to use, that is also blue dye, isn't it? And that dye, blue dye, was discovered by Evans, so we are going to call it as Evans blue dye. And there is a one big protein which cannot cross the plasma membrane, and that is nothing but albumin. But the same problem that we had with the sodium, I'm going to have same problem with the albumin also. That means the albumin is also present in my blood already. So I'll not be able to know which albumin I have given to the patient and which albumin is there, which I have given, and which albumin was already there in the patient's body. So what we can do, we can label it with the radioisotope again. All right. So what I'm going to do again, I'm going to give the radio labeled albumin. Okay. So either you're going to use the blue dye or you're going to use the albumin. That is for plasma. Okay. Albumin and Evans blue for the plasma. All right, so these are the direct method, and if I have to measure the ICF, let's say I require the dye which is going to measure 2BW, I require one dye which is going to measure ECF. So whatever volume the dye has given me, which gave me the ECF, I'm going to subtract that volume by the volume given by the dye which measure the total body water, right? And that's why with the indirect method, I'm going to get the ICF. So if I ask you this question, can you solve this question? Solve this question, fatafat se, and then we'll finish up this class. Next class may we are going to talk about the shifts of body water. Hanji, fatafat se answer karo. What is the answer of this question? Can you give me the answer? In the dye dilution method, the interstitial fluid volume is best measured using which of the following? Hanji, तो आपको करना क्या है? आपको measure करना है interstitial fluid. Can you measure it with the direct method? No. Interstitial fluid. Right? Interstitial fluid, that means we have to use the indirect method. We have to use the indirect method. So give me the indirect method. Which dyes we are going to use? What is the formula for interstitial fluid? Hanji. Interstitial fluid is going to be measured as ECF minus plasma. So what are the dyes which are measuring the ECF? I know that the plasma is measured by blue dye. Which blue dye? Evans blue dye, isn't it? So Evans blue dye or the radio labeled albumin. Radio labeled albumin. And what about ECF? ECF can be measured by Simon. One of the dyes should be there from the Simon, that is nothing but the sucrose, inulin, mannitol, very good, and the sodium iothalamate or thiosulfate. Isn't it? So please remember, out of these dye I want the dyes, right? But what they have given, see over here, they have given the inulin and Evans blue. Can I use it? Yes, inulin is present in the ECF and the Evans blue dye. Yes, if these two dyes are present, I can measure the interstitial fluid. Yes, I got the answer. Please remember, Evans blue is there, but D2O is going to give me total body water. It has absolutely no role in the measurement of interstitial fluid. Definitely, if they would have asked about the intracellular fluid, then definitely I would have used the Evans blue plus D2O. Right? T2O, again, tritium oxide is nothing but the T2O. T2O is going to be used for the measurement of total body water again. So total body water has no role in the measurement of interstitial fluid, right? This is again is required for the measurement of the intracellular fluid, right? Mannitol and D2O is also, D2O has no role. Again, rest of these three, B, C and D, they are going to be used for the measurement of intracellular fluid, not the interstitial fluid. So the answer over here is going to be the inulin and Evans blue dye. Inulin and the Evans blue dye. Do you understand what we have talked about, right? Let's do a quick recap and then I'm going to finish up the class, and next time we are going to start with the shift of body water. So the first thing that we have learned is 60-40-20 rule. What is 60-40-20 rule? It was 60% of the body weight is going to be total body water, 40% of the body weight is going to be ICF, and 20% of the body weight is going to be ECF. So 60-40-20 rule, TBW, ECF, ICF and ECF, right? So if I ask you, if let's solve one question on this, if I ask you there is a 70 kg man, calculate its ICF and ECF. Can you calculate? And let's calculate the total body water also. So how can I calculate that? If they have given this much information, so what you're going to do, you know that the 60% is going to be the total body water, 20% is going to be the 20% is going to be the ECF, and 40% is going to be the ICF. So let's talk about ECF. If I have to calculate the ECF, what I'm going to do, I'm going to multiply it by 20%, isn't it? 20% of the body weight. So I know whenever the zero wala value is going to come, I know that those two zeros are going to cancel out because I'm going to divide that up by the 100, right? So I'm directly going to multiply it by 2. Right, so the value is going to be 7 true, that is going to be 14. Same is going to happen in the case of ECF, that is 40%, right? So how much it will be? It is going to be the double that of the ECF, so that will be 28. And what about the total body water? It is going to be 60%, and that is going to be 42 liter, right? So all of that will be in liters. All right? Please remember that. That's how you're going to calculate. Please remember, when the zero is going to come, you just have to multiply whatever value is going to be there. Okay, so please, that's how we are going to use the 60-40-20 rule. So body weight is going to be 100%, then the total body water will be 60, intracellular will be 40, extracellular will be 20, plasma will be the 5%, blood cells are usually 3%, right? So that's why the blood volume, plasma volume is 5%, blood volume of the body weight is going to be 8%. Right? If I talk about the transcellular fluid, it is the fluid which is present in the cavities. Various cavities I'm going to have, such as pericardial cavity, peritoneal cavity, pleural cavity, synovial fluid, vitreous humor, aqueous humor, CSF. All these are going to come under transcellular fluid, but we don't bother about it in the calculation. Why? Because I know that this is going to be very less. Okay, now the 60% that we talk as a thumb rule is going to be true for the males, but not for the males and the smaller babies, right? Newborn babies. So F for female, F for fat. So please remember, females have more fat, and that's why the gallstone, the most common gallstones are going to be the complications, or you can say the gallstone are more commonly going to happen in the females, right? Fatty female, 40, we used to remember like that. Okay, you'll learn that eventually. Newborns are going to have more water, exactly opposite to that of the females, isn't it? So 70 to 75% of the body water is going to be there in the term baby. That means who delivered on after completing the fetal life, right? The baby who is born way before than the actual delivery time, then that will be called as preterm baby or premature baby. He is going to have, or she is going to have, lot more water, that is up to 90%. And that's why when the baby start having diarrhea, we are very worried, because we know that most of their body weight is nothing but just plain water, isn't it? And if they ask a special question that ICF and ECF will be equal, that will be 3 to 4 months after birth. And similar to adult composition will be that will become at 1 year of age, around 1 year of age. So if they showed you this kind of a diagram, that you will be able to identify that when the ICF is equal to ECF, that will be called as the that is nothing but the age of 3 to 4 months, and 12 months, that is nothing but 1 year. The adult composition, the composition of the body water of the baby will reach to adult composition. All right, estimation, we have done that with the principle, Stewart-Hamilton principle. We have learned since 8th standard, we used to learn that amount is equal to concentration into volume. we have to measure the volume over here. So we have just modified the formula, that will be volume is equal to amount upon concentration. But there is a problem. What is the problem? That the body is not the ideal scenario. I'm going to metabolize some dye and that will be excreted throughout the kidney. So I have to subtract that dye because that is not getting distributed. That is going to go out of the body. So please remember, amount of the dye, C is the concentration of the dye, E is the amount that got excreted, right? So A minus E upon C, and we have solved this question. What thing you have to take care of is the units, right? Units are very, very important. All right, then we have talked about the leakage, or if you give excessive dye without knowing, right? If the scientists have given the excessive dye, that means the concentration is going to increase, and whenever the concentration will increase, the volume will decrease. And whenever the concentration is decreased, let's say while giving the dye, some dye got leaked out, right? But we have calculated the amount in toto, right? We have not considered, or we didn't notice that some dye got leaked out. Then only these changes are going to happen, and that is what will be given in your exam. So please remember, it is unnoticed one. So amount, what we wanted to take, we have taken that. We didn't notice that the dye got leaked out. So whenever the concentration is going to decrease, of course the ratio is always and always inversely proportional to the denominator. So with the vice versa change is going to occur in the volume as compared to the concentration. The concentration is decreasing in the leakage, the volume will be increased. And if there is a miscalculation, or you have given the excessive amount of dye, if you give more dye, then what will happen? Definitely there will be you can say more dye, more concentration, lesser will be the volume, falls low volume. All right, we have learned that inside the cell, whatever volume is there, that will be called as intracellular fluid. Inside the blood vessel, whatever fluid is there, we can call it as plasma, and in between, interstitial fluid. Interstitial fluid and plasma together will form ECF. If the dye is able to cross the plasma as well as the cell membrane, then that will give me the total body water, right? But the dye is able to come and cross the plasma membrane but not able to cross the cell membrane, then definitely it will not enter into the cell, but it will be able to enter of course we are giving it in the plasma, and it will enter into the interstitial fluid. So together we call it as extracellular fluid. It will be giving me the extracellular fluid volume. If I give the dye and that will go into the blood only, then definitely it will give me only and only plasma volume. All right, so we cannot calculate the I wala volumes, that means interstitial fluid and the intracellular fluid. I cannot calculate with the direct method. I have to use the indirect method. ICF will be equal to TBO minus ECF, right? ICF will be TBW minus ECF, and IF will be ECF minus plasma. So the same thing we have seen in the diagram also, and the total body water, the dyes are going to be D2O, T2O, aminopyrin, 3 dyes only. D2O, T2O, aminopyrin is going to be used for total body H2O, H2O, D2O, T2O, aminopyrin. Remember, for H2O, we have to use D2O, T2O, aminopyrin. For ECF, Simon, and for plasma, asthma, blue or albumin, right? Blue or albumin. Please remember that. And that's all from my side. Let's end the class with a very, very nice message. I'll be taking this, these are the diagrams of shifts of body water. It is a little bit complex topic, right? We don't have that much of time. So next time I'm going to just giving you overview. I'm going to teach you all these shifts of body water, and I'll make sure that you remember that throughout your entire journey of medical life, right? So running water never grows stale. So you just have to keep on flowing, right? Keep on moving on. Even if you do some mistakes, don't get emotionally attached with it. Just move on and keep doing and keep practicing the MCQs more and more. So you'll definitely grow, right? So all the best and see you next time. Okay, take care. Thank you, Vikram. Thank you, Anshu. Thank you, Satish. Thank you for all of you giving the replies. Take care. Bye-bye. Happy Independence Day to all of you.